So I'm just going to have you introduce yourself, tell a little bit about the company that you work for, and what your day-to-day looks like.
So I'm Angela Breer, the Communications Director for the American Heart Association. A typical day-to-day is not typical. There is no typical, especially when you work in the field of health and nonprofit. Things change constantly. So a typical day, though, would probably be, the basic office stuff. But one of my goals is to work with survivors and individuals in the community to tell their story. And oftentimes people think of heart disease and stroke as being death sentences, and in reality there's a lot of positive health spins for that. So working with survivors and volunteers to get them engaged and share their pieces.
Wonderful. Okay, what made you choose this career path, and what made you come to work here at this American Heart Association?
The career path, I started in development and then moved to communications. But for me, it's working for an organization that's doing something bigger and better than themselves. It's having a pulse in the community and giving back in the work I do every day. I can't imagine going to work and just putting in the grind and not really making a difference. It's the idea that I am fighting for a healthier community, and I'm doing that every day at work. When I switched to communications, though, it was a very different role because I touched so many different sides of the organization, and because of that, I have a lot of opportunity to spread our messaging and do things in fun ways.
Awesome. Okay, so what excites you most about coming to work every day in your job?
The most exciting thing for me is probably that no 2 days are the same. I have a routine, but it's not a routine. It's things happen different ways, but for me it's ultimately working with individuals from babies to kids to adults to teenagers to elderlies, individuals, and spreading what heart health means and what it looks like and how it differs for everyone.
Amazing. Okay. So do you feel that you make a difference or an impact on people, and if so, what specific area of our population do you affect?
I do feel like I make a difference, and that's why I'm here.
You do too.
But I would say we don't really just target one area of the population, because heart health impacts so many people. Everyone has a heart, everyone has a brain, so stroke and heart health is important. But I would say my favorite individuals to work with are the kids. And that's mainly because they have so much energy and so much resilience that things they've faced, they get past, and it's exciting to see how they can make an impact that will last a lifetime.
Amazing. Okay, if you could give one piece of advice to someone going down your career path, what would it be and why?
The one piece of advice would probably be find something you love and go for it. For me, I believe in the mission and everything the organization stands for, and so it's just easy to love the work you do when you believe in what the organization's doing.
I completely agree with that. Okay, if you had the opportunity to experience your career path over again, would you do it differently at all, or would you go down the same path?
That's hard to say because I'm very much a forward-thinking person. Like, I don't know. If it was done differently, it would just be different. But I would definitely say I would find an organization that you love and go for it and really pound it out and see if that's where you're going to last or where you're going to end up.
Okay. What personal qualities or abilities are important to being successful in your career path?
I would say compassion and understanding. Because we work with so many different types of people and so many different areas of the population, you have to put yourselves in their position and not just think of it as, us telling them what to do, but how can we help them along the way. So I would say the compassion and understanding.
Amazing. Okay. How do you see jobs in this field changing your future and the future of others?
Do you mean, so say that again.
How do you see jobs in this career path or field changing your future or the future of others?
Well, for me, because on the communication side, we work with the media and social media and all of those different areas. I would say mine constantly changes of how do we tell the story differently, or how do we get it so people see that their health is their number one priority. So for us, it's constantly changing, but I would say, what is that? I'm not sure.
Is there a time or person you have encountered that made you, or that you made a difference in their life, or they made an impact on yours that you can tell me about?
I have met a lot of people, and there are a couple volunteers that I think of that come to mind that from the very first time I met them, they have impacted my life. Their story has touched my life, and every day I come to work and I think I'm fighting for Tracy, I'm fighting for Emma, I'm fighting for the Bakers, I'm fighting for these people because they've made an impact and I need to do the same.
That's inspiring. Okay. Why do you think your service is so valuable to the society that we live in?
That's like a big question.
Big question.
I would say I consider the work that I do kind of being in the public health area. Mm-hmm. And so along with that, it's a society thing. We're all in this together, and I can't do my job without someone else doing their job. And we're only as good as our weakest link. And so we need to be stronger. And how are we going to do that? We're going to work together. So I would say the service is what I bring to the table, but others have to be at the table. I can't do it alone.
Well, we just want to say thank you as a society as a whole for your service that you do for us.
Thank you.
Appreciate it.